So sinus arrhythmia. So again, sinus, even though it's abnormal, is initiated from the SA node. And one of the things, it occurs when the sinus node creates an impulse at an irregular rhythm. Rates usually increase with inspiration and decrease with expiration, and it does not typically cause a problem. Now, by looking at the picture in the corner, you can see that it's arrhythmic. But if you look at the EKG and should space or should look at the spaces between the R's, you can see that okay, this is the same, but this is wider, this is wider, this is wider, okay, and then it becomes smaller. So the spaces between the R, they are not regular, they are irregular. Yes, the impulse is coming from the sinus node. However, the impulse that is coming from the sinus node is irregular. And so that's why you have the spaces between the R's, some wider, some smaller. And so that's how you can tell too if the rhythm is regular or irregular. Atrial flutter, but it occurs due to a defect in the conduction in the atrium and result in a rapid regular atrial rate. Now, why is it regular? Remember first, when we started out, I show you that the P wave is the first elevation of the isometric line. So if you look at these, they're regular because they're consistent, even though they're not normal, even though they're flutter. So it occurs only in the P waves. And when we talk about the P waves, we're talking about, for those of you who are online, these in this area we're talking about, because remember, normally there's one P wave, a QRS complex, and then a T. But as you can see that this rhythm here is going very fast, usually 250 to 400 times per minute. So even though it's fast, it's regular. But this is what they call atrial flutter. And how you identify it, what do they call these? They call them flutter, but there's another thing that they call them, sawtooth. It's also described as a sawtooth, or some people call them an F wave. Okay, but we know that it's an atrium. By looking at it, we know that it's an atrium because these elevation, these high peak elevations, these high peak elevation in this area, we know that this is the ventricle. So these here have to be the atrium. So something is wrong with the atrium, and we can identify it by the sawtooth, or some people call it the F tooth. And so this is that the atrium is beating 250 to 400 times per minute. What is it that causes atrial flutter? Individuals who have obstructive pulmonary disease are noted to seen with atrial flutter. Valvular disease, and we're talking about the valvular disease, we're talking about mitral valve prolapse, and also thyroid toxicity, meaning that individuals who are having a thyroid storm, excessive amount of thyroid level or increased thyroid level, or this individual could have a congenital heart defect. That's why they're having the problem. So if you look at the screen again, if you should compare the strip above and the strip below, you can see that the P wave nicely formed. That's one of the things when you're reading EKG too, you should look at. The P wave should be round, and normally there's only one, and there should only be one P wave. So as you can see here, a sawtooth indicating, and it is the atrium. We know that because the P wave is the one that's affected, and so that's how we know that it's a P wave. It is a atrium and not the ventricle because it's a P wave that's affected. So we said that it looks like a sawtooth. They will complain of chest pain, shortness of breath. And so one of the treatment is beta blocker. They'll give them also calcium channel blocker. They'll give them also the digoxin, or what they'll do something called catheter ablation. What that is again is that they'll go in and look at the part of the heart that is beating irregularly and actually remove that part. Treatment. Sometimes they'll do vagal maneuver, having the person to bear down, or they'll massage the carotid artery, or they'll give adenosine is one treatment for atrial flutter.